Hello and welcome to Home Instead's Dementia Training Workshop. So what is dementia? Dementia is not a normal part of ageing. It occurs when the brain is affected by a disease. Everyone is unique and will experience dementia in their own way, and different types of dementia will affect people in different ways. Symptoms may include the following. How people respond to the person with dementia and their environment are other factors that will impact on how well someone lives with dementia. Here is some gathered data indicating how many people in the UK are affected by dementia. The Alzheimer's Society estimates that 1 in 3 people with dementia do not have a diagnosis, implying the actual numbers could be much higher. Home Instead has its own report, the New Ageing Index, into the impact dementia has on families, and these are just some of the findings. So what causes dementia? There are many diseases that can cause gradual changes and damage to the brain. Staying mentally and socially active, as well as consistently getting quality sleep, are also ways to prevent the risk of developing dementia. The most common type of dementia is Alzheimer's disease, which is a physical disease of the brain. This leads to the death of nerve cells and the loss of brain tissue. As the disease progresses, more parts of the brain are damaged. As this happens, more symptoms develop. The symptoms are usually mild to start with, but become worse over time and may start to interfere with daily life. For most people, the earliest symptoms will be memory lapses, such as recalling recent events and learning new information. They may also experience changes in their mood and become anxious, irritable, or depressed. As the disease progresses, the person may also experience the following. This picture of the brain helps us realise that the disease is real, and the experience of clients living with Alzheimer's disease are caused by the effects of the disease. The brain becomes smaller, with large spaces where there originally was brain tissue. Vascular dementia is the second most common type of dementia and results from brain damage caused by diseased blood vessels, which may become blocked or leak. This means that blood, carrying oxygen and nutrients, does not reach the brain cells, and the brain cells will eventually die. This death of brain cells can cause problems with memory, thinking, and reasoning. These three elements are called cognition. A common cause of this is the person having a major stroke or one or more smaller strokes. When these cognitive problems are severe enough to start affecting an individual's daily life, it's known as vascular dementia. Lewy bodies are tiny deposits of a protein that appear in nerve cells in the brain. These deposits cause dementia with Lewy bodies and Parkinson's disease. Symptoms of dementia with Lewy bodies are similar to those of Alzheimer's disease. The person may also have problems with attention and alertness. They may stare into space for long periods, or their speech can become disorganised. Visual hallucinations are also common, in particular during the early stages. As the disease progresses, their walking may become slower and less steady. Falls can become more common. They have difficulty with speech and swallowing, and that can lead to chest infections and choking. Although Alzheimer's disease is the most common type of dementia, increasing evidence indicates that many people with dementia have brain abnormalities associated with more than one type of dementia. Mixed dementia appears to be Alzheimer's disease and vascular dementia. Frontotemporal dementia is caused when nerve cells in the frontal and or temporal lobes of the brain die and the pathways that link the lobes change. As the disease progresses, the brain tissue in the frontal and temporal lobes shrinks. Symptoms can include changes in personality, behaviour, and language difficulties. The effect of changes on the brain on how a person lives can be influenced by a range of other factors, such as their health, their personality, who they have around them, and how they're treated, as well as previous life experiences. Someone is said to have young onset dementia if they develop symptoms before the age of 65. The age of 65 is used because it's the age at which most people traditionally retire. Other terms used for this condition include early onset dementia and working age dementia. Diagnosis can be delayed as the symptoms may not be recognised as dementia at this age. Common symptoms may include the following. When someone shows the early signs of dementia, it's important that they see a healthcare professional as soon as possible to complete the necessary tests and evaluations. There are a range of healthcare professionals who can diagnose dementia, such as psychologists, neurologists, and other mental health professionals. Many GPs can also do the basic evaluation for dementia too. While there is currently no cure for dementia and no treatment or drug to reverse or halt its progression, there are medications that can help treat symptoms in some people. If dementia is diagnosed early, drug treatment may enable your loved one, or the individual, to perform the task of everyday life, such as washing, dressing, and preparing meals. Healthcare providers may also use other medications to help care for coexisting health or mental health conditions, such as depression. The use of medication for changes in behaviour is not considered best practice, but it's important to remember that changes in behaviour are usually a way the person, who is living with dementia, communicates a need. The need may be physical, psychological, or social. People living with dementia may experience a different idea of reality or sense of what is going on from our own. It can be unhelpful to confront the person with the truth when their reality is different to yours. We must remember to step into their reality and not expect them to come into ours. For example, if we remind the person that his wife, who he's been asking for, has passed away, he may start to grieve all over again. Although this is not always the case, the grieving process may happen every time he's told that his wife's passed away. Initially, it may help to redirect the person onto another subject or an activity. If this doesn't work, try asking about his wife, about their life together and the holidays they went on. It's always better to respond sensitively to the person's feelings. They may be asking about his wife because he feels lonely. If so, we could try and provide company for him. It's also important to remember that the person with dementia is unique and having their own experience of living with dementia. Some days they may accept a situation, the next day they may have a different reaction. What helps them one day may not help another day. If a person is seeing something that's not always there, we must remember to them it is real. As we can't see what the person is seeing, we will need to ask where it is and take their concerns seriously. For example, a dark-coloured rug on the floor may look like a large hole to someone living with dementia. One of the difficulties often faced by those with dementia is difficulty with verbal communication of their wishes and needs. A person with dementia may not be able to tell you that they're upset, frustrated, or angry about something. So you need to be on the lookout for non-verbal communication cues that provide clues to how the person's feeling or what they're thinking. For example, the person may still be able to smile to show happiness, frown to show frustration, pace if they need to use the bathroom, or grimace if they're in pain. Non-verbal communication includes body language such as facial expressions, eye contact, movement and posture. The tone, pace, speed and volume of the voice also needs to be considered. It's important to understand how individuals with dementia may express themselves through behaviours. This is usually means of them communicating a need. They may display behaviour such as crying, shouting, fidgeting in their seat, walking around, or declining to eat or drink. The challenge is to try and understand that this is how the person with dementia is communicating and that they are trying to communicate a need. Offering simple choices is less complicated and helps a person feel in control. Offering a reduced choice enables the person to more easily work out the options and make their own choice, helping them to retain some control. If the person's upset or distressed, they may be unable to make choices at that time, but we must always allow time for them to make choices and not rush them. Speak clearly, use picture prompts, and point to items to aid communication. There are several benefits of engaging the person in activities too. Examples of the 3 types of activities are intellectual, like completing a crossword, doing needlecrafts or dominoes; physical, like walking, gardening, dancing and seated exercises; and social, phone calls, video calls, community classes, workshops or outings. Many people with dementia choose to stop driving voluntarily because they begin to find it stressful or they lose confidence in their abilities. A person should consider stopping driving if they feel the following: The behaviours we've discussed today stem from the symptoms of dementia, but some actions are unrelated to dementia. Sometimes the cause is much more simple and can point to other concerns regarding the individual's general health. Problems don't always originate in the brain, sometimes they're rooted in the body. Research has found that people who live with dementia are likely to have other health and medical related conditions, and that as the dementia progresses, they will develop more of these conditions. Some of these health related conditions can be managed with medical treatment or through quality care. Please see a list of resources that you may find helpful, like the Alzheimer's Society, Dementia UK, Age UK, Carers UK, and Supporting Young Onset Dementia. Thank you for listening today. If you'd like more information, Home Instead also have a dedicated YouTube channel. Search @Home Instead UK. There's some fantastic content on there showcasing real stories, shared experiences, tips and advice